Hi, welcome to Task Talk, Real Change. My name is Linda Oristano. I am the Executive Director for the Northport East Northport Community Drug and Alcohol Task Force. And we are so happy to have with us today Dr. Gregson Pickett. He is the Commissioner for Suffolk County Health Department. Welcome. We're glad to have you here.
Oh, thank you. Thanks for inviting me.
We're going to be talking about National Minority Mental Health Month, which is really important for us to learn about and to know more about and to share with our community members. What does National Minority Health Month mean to Suffolk County?
So the whole idea of naming a month for something is to raise awareness about a particular topic.
Right.
And so mental health, definitely something we need to raise awareness about.
Can you share how the Department of Health promotes mental wellness for the communities?
So we have, at least the Department of Health, we have our Division of Community Mental Hygiene Services as a part of the Health Department, which is very important because we have a tremendous relationship with our Director of Community Services, Carrie Faith Besserman. She oversees that department very well. We oversee contracts that go to different agencies that provide mental health services. We also provide mental health services of our own in our Farmingville Mental Health Clinic. We have our opioid treatment programs. We have 3 sites, 2 in Hauppauge and 1 in Riverhead. And so because of that relationship, it just keeps us all aware as a health department of mental health issues. And it's a good relationship to have. We also have our Office of Minority Health, which was created in 2005 and addresses issues that pertain to communities of color in Suffolk County, particularly Black, Hispanic, and Asian, also the indigenous populations we have in the East End.
Okay, great. That's wonderful. What do you find are the most pressing mental health challenges facing minority communities today in Suffolk County?
I'd say anxiety and depression, probably front and center. And I'd say of those, it's really people realizing they are in I wouldn't say over their heads, but they're in a place where they need to actually seek help, professional help, and get services. And then knowing that you need help and then actually accessing the help are 2 different things. And there's often a disconnect with communities of color.
What disparities do you see in access to mental health programs?
Well, that's the whole thing is that a lot of the times when we got in the communities and we talk about mental health challenges and trauma, addressing trauma, substance use disorders, it's a question of, well, what do I do? And that's where the issue lies. It's just introducing people. Like we come out with this directory, our Division of Community Mental Hygiene. They came out with this behavioral health directory.
Wonderful.
It's on the Suffolk County Health website. And it's also in a user-friendly format now. Like we've tweaked it just to make it, it's very push-button centered. So that say, hey, I want to access treatment for depression, and you can push this button. It will give resources. Mm-hmm. Not necessarily people in private practice. We're looking to connect people with agencies or larger organizations that we have a relationship with that may be funded through us or that we've worked with in the past. The other issue with the access piece is that let's say I need individualized therapy. And so I have someone who has MSW, LCSW, psychologists, et cetera. They're not working for free, right? And a lot of the times when you have health insurance, it's an issue of how much of those therapy sessions are covered, how much do they cover, what's the copay. It can get pretty expensive. And then some therapists do not want to deal with insurance entirely. And it's like, look, it's
I'm finding that a lot, yes.
So that's another one of the major issues is, yes, I know where I can find help, but then how can I afford the help?
Mm-hmm.
Yeah, that's why we generally prefer people to go through agencies that provide services because then they might have a better billing apparatus. They might be able to deal with insurance company issues better so that you can actually access the services with a co-pay or with minimal out-of-pocket costs.
And I know sliding scales, a lot of agencies work on sliding scale too, which is great.
Yeah. And then the last thing you want is that people defer getting help and then it becomes to some kind of a crisis point where you're having a suicide attempt.
Right.
Or some other episode that requires either hospitalization or emergency room visit, then it's there's so much damage that has been done at that point.
Right. What are some mental health challenges that you're finding young people are experiencing today, especially like in maybe underserved communities? I mean, I know you mentioned anxiety and depression, and we see that a lot. But is there anything else that stands out for our young?
Well, in that space of anxiety and depression, what you have now, I grew up in the 80s pretty much. High school in the 80s, we didn't have cell phones. And the one thing we definitely didn't have was the internet. We didn't have any TikTok or Facebook or anything like that. And a lot of our young people are now exposed to this culture where it's very open, it's very loud. There's this thing where you might have something posted about you, or something that somebody recorded you saying something, and it gets out there, and there's just so much that feeds into this anxiety and depression now that's social media based, that it's difficult to take stock of, and something that we didn't have to deal with when we were growing up.
Right, exactly. Yeah, I don't even think anybody would talk to me about anxiety or depression when I was growing up. It just wasn't something we talked about.
Yeah.
Secrets. Everything was a secret, right?
Keep that to yourself.
Yeah. Don't air your dirty laundry, right? How can families and schools better support youth mental health and emotional well-being?
And especially adolescent age, you want to have access to treatment readily available. So I like that schools have partnered. I've heard of partnerships with school districts and Northwell Health, for example, where they've had treatment providers actually on the premises. That's huge because it kind of removes a barrier right there for people accessing treatment, where a young person can go right down the hall and say, hey, I'm having a particular concern. Can I talk to somebody? And there's help right there. That's a big deal.
I had a meeting yesterday with Huntington Drug and Alcohol Counseling, and we were talking about how prevention and education are so important, to getting information out there. And then the other piece was, well, what about the actual treatment piece? It's very hard, especially parents, like they don't know, where to go, what to do. And these are some of the things that we tried to help them with, the awareness, of what's available to them. If you have parents that don't know of something, the best thing they could do is, I think, go to your website, correct? You have a lot of information.
There's a lot of information on the Suffolk County website.
Right. Mm-hmm.
Yep.
And I do know that the schools have the share programs, where they have peer-to-peer.
Yeah, that's something I've seen, and I'd say maybe in the last 10 years.
Right.
Use now of people with lived experience, what they call peers, who may not have, gone to school for traditional mental health treatment professions, but who are, because of their lived experience with some training, they can now offer support to people going through similar challenges. That's great.
We have, I don't know if you know of One Life Coalition. Our youth coalition is in Northport High School. And that's a really great program because it's not a club, but it's a coalition where students come and they discuss mental health issues, and they discuss environmental issues, and substance misuse, and what they could do about it. So that's a good example of how, some of the students there are trying to get the message out to other students in the school.
Yeah.
By doing recovery awareness, prevention programs, wellness week, making healthy choices, all of that. How does the department ensure that mental health services are culturally competent and inclusive?
That's always a challenge. That's you try as best as you can, really. But when it comes down to, especially someone who does not speak English as a first language, that is the most challenging piece, because then you need a provider network that speaks the language that that person does. Otherwise, you're using an interpreter for the most part, and that generally is not as comfortable because there's always a third person in the encounter. So that is probably the most difficult challenge there. A lot of agencies are looking for multilingual staff to address those particular concerns. And that even on the cultural piece, that my lived experience and what I experienced growing up is probably going to be different than yours, Linda. And the issues I'd want to talk about with a therapist are going to be different or might have a little more of a cultural context than you would have probably experienced. Right. So finding that provider that can relate to those particular experiences could be a challenge. And so you try to educate your consumers as best as possible to look for somebody that can relate to your experiences, that may have had similar experiences, to provide treatment. But it's not always that easy to do. Sometimes there is a lack of providers that are of the same culture or the same background as you.
Mm-hmm. Yeah, that must be a very difficult thing to do if you have somebody that you're seeing that doesn't really understand where you come from and what your background is. So I would think that would be very hard. What role does hiring diverse mental health professionals play in improving the outcomes in the minority populations?
Oh, it makes a big difference, because I can say that, I went to a Pentecostal church growing up, and, when I said I was feeling a little down, that the pastor would come and lay hands and pray for me. And then I might be telling that to you, and you say, okay, I understand what you're saying, but I didn't live that experience. So how can I relate to it? And how can I even take that spiritual piece aside and address that? Right. So if you have a therapist that comes from a similar background, then you can say, oh, yeah, I used to, or I've, experienced a situation like that, or I went to a church like that. I know exactly what you're talking about. And I know the intersectionality between spirituality and mental health. And you can do both. Yes, you can be, spiritually aware and may have your pastoral counsel, but you also need to have a professional mental health treater, someone to treat you as well in that space. And it's a difference.
It is a difference. And you know what, you bring up one of my favorite topics, which is spirituality. So how does spirituality play in the mental health field? How do you think it plays with it?
For Black and Brown communities, it is essential to our support system. That's how we grow up, It was a study many years ago. I think it was a Pew Research study, but something like 80% of African Americans have some kind of spirituality, whether it's a Christian denomination or something like that. But it's very important in our upbringing. Mm-hmm. And maybe in this day and age, a lot of people are not church going or active in a religious body or organized religion, but do have a sense of spirituality. And it's something that you need to address in a mental health space. A lot of times the church was actually our therapy room, mm-hmm. right? That you'd be surrounded, by people who would love on you. That's the expression that we used back then. And check on you, make sure you're okay. And the pastor that would pray for you and make sure your spirit was at ease. You'd have good, uplifting gospel music or choir music or hymns, and that would kind of give you a little support there. You mm-hmm. just feel encouraged after you went to a church service or a prayer meeting or something like that. And just to be able to integrate that with treatment, because sometimes that's just not enough. And you need the mental health professional to address hidden traumas, the adverse childhood experiences you might have gone through, some other situation that you might be dealing with right now, or maybe it's a substance use disorder that has come up. Whether it's alcohol or cocaine, crack cocaine, and God forbid if it's an opiate. That's something that's still very hush-hush and taboo in communities of color.
It is, yeah. Can you talk about that a little bit, or the opioid situation?
What we are seeing in Suffolk County, so I came to Suffolk County in 2009 as the director of the Office of Minority Health, and learning about the opioid use disorder and opioid overdose deaths, etc., that was predominantly a white middle-class issue. And the statistics bore it out that over 90% of the overdose fatalities were in white Suffolk County residents. And it was as plain as day. Like the medical examiner's office broke it down by race and ethnicity. And it was over 90%. Wow. What has happened since the pandemic is that now you are seeing the African-American fatality rate over 10%, whereas the Suffolk County percentage of African-Americans is around 7 to 8%. Mm-hmm. The overdose fatality death rate now is above 10%, which is something that we had not seen previously. But these are things that are concerning And a lot of the times when you talk to, especially in the African American community, and you talk about opiate use, it's disbelief, it's denial.
Yeah.
And it's a lot of folks who are not admitting that that is an issue that they're dealing with. So there's this kind of a hierarchy of substances. So yeah, alcohol, yeah, sure, I have my 40 ounce, I have my Hennessy, smoke a little weed, roll up a blunt. Crack is a little bit, crack is whack, but yes, but there's it's something that is commonly used. Something that we're seeing as a trend is that these overdoses now are not just one drug. They're not just fentanyl overdose deaths. It's fentanyl plus cocaine,
right,
plus marijuana, all right, plus benzodiazepines, Xanax, etc. So there's a lot of mixing of drugs that's going on. People like their particular cocktails. It's, I've maybe a crack user, but I just like the feel that I get when I have crack and that little fentanyl.
Right.
But nobody talks about the fentanyl.
No.
That's taboo.
Yeah.
And that's the one thing that I'm having a hard time, me as a health commissioner, as a provider of color, as a medical doctor, going out in community settings and talking about the fentanyl crisis, because really that's what's causing the overdose deaths is the fentanyl that stops your breathing and you have a respiratory arrest. Just to make that plain, it's the fentanyl is the main component that people die from, unfortunately. But the mixing of drugs and particularly the fentanyl issue, it's just very hard to bring up and it's hard to get traction. It's hard to get buy-in. And it's just hard to get people to do things like take Narcan, take a Narcan kit with you or get fentanyl test strips. You bring them to events and they're still kind of sitting there at the end of the event and you're not having too many people come to your table and take them. You have some, yes, but it's still an uphill battle. Just for so many years, because so many years we were saying that it was more of a white middle class issue.
Mm-hmm. That's really interesting. With the Narcan, we teach Narcan also, and we try to get it out there as much as possible. And we just did recently Pride Fest, and I was amazed at how many younger people were coming up to the table for Narcan kits. I actually ran out. It was like I was really surprised. I was pleased on one hand, but on the other hand, I was so concerned, because they were younger than your normal people that would come and get the Narcan.
That's good.
And I think
that's what we want.
That's exactly what we want. And, I wish the schools would do more of it. And, we're working to try to, convince them and to make them realize how important it is. It just should be readily available. I'd like to see every parent have a Narcan kit in their home, just like they have a first aid kit. You may never need it, but you know what? It's so great to just have it.
I remember the early days when we started giving out Narcan and you had the vial and then you had to teach people how to turn the thing and then you had to put the atomizer device on and it was a process, Now it's so easy. It's a one-piece thing and it fits in between your second and third fingers and your thumb. You go,
it's a nose spray.
It's so easy.
Yeah. And anybody could use it. So it is.
You don't really need training now. You used to have to go to a training course.
Right.
You get to actually sit there because it was a process. Now just take the kit and open it. And if you see somebody you can't wake up,
right,
then squirt it in the nose.
Yeah. And what's good is we put the little cards right in the kit that tell them what to do.
Yeah.
It's like step 1, step 2. So we try to make it as easy as possible. That's really important. How do you think that fentanyl has increased on the island or in Suffolk County? Have you seen a decrease? What do you think?
Stats show that there's been a decrease between 2023 and 2024, that the amount of overdose fatalities is starting to go down. Doesn't mean that we're at sort of a low point. I hope it continues to trend down. This year, I think this year's numbers are about the same as 2024. I have to double check. But we hope that continues to be a downward trend.
Do you attribute that to education and prevention or lack of access?
It's a combination of things. I think people have kind of gotten the message that this stuff is dangerous and I shouldn't mess around with it. I think that's probably one of the the bigger deals is that, it's the message has gotten through. So I guess that is on the prevention side.
Right.
I think access to treatment is much better, whereas even 2-3 years ago, if you wanted to get on methadone, because the mainstays of treatment for opioid use disorder are buprenorphine or Suboxone or methadone. If relapse is common, if you've relapsed several times using other things, abstinence-based, then medication-assisted treatment is the way to go. But those are the top two: Suboxone, which you can actually prescribe, and methadone, which needs to be dispensed at a facility. So it used to be that Suffolk County Department of Health was the only game in town if you wanted to get on methadone, that you'd have to come to one of our methadone clinics or opioid treatment programs. Now there are other providers that are offering treatment, and they can do Suboxone as well as methadone, which is a game changer.
Right.
Because now you have access to methadone in different communities that have never had it before. We're talking Huntington Station.
Yes.
We're talking Farmingville,
Brentwood, right?
Shirley.
Mm-hmm.
These have come online in the last few years. That's a big deal.
Mm-hmm. Yeah, that's really important.
And it's not people always think of methadone as this thing where I got to stand on some long line, and it's a bunch of addicts there, and it's so disgusting.
Right.
Now you're just coming to a treatment center. You have a regularly scheduled appointment. People don't know what you're there for. There's no line outside the building.
Right.
And you're talking to your provider, and, you might have gotten a script for Suboxone, or you could have gotten methadone. Nobody knows. So it's much more anonymous. It's much more what they call patient-centered, which I actually like that word, because you're looking at the needs of the patient, and you're treating that individual as a person. You're treating that as a whole human being who you want to do well, who you want to have a good recovery experience, who you want to be gainfully employed, to have a family, and to really live a normal life, even though they might have addiction issues.
Right. So many people are not for medication-assisted treatment. They think that if you're going to get sober, if you're going to get clean, you got to do it straight on.
We've tried it.
Yeah, talk about that a little bit, because
tried it that way for years, but
it doesn't work.
There's something that your brain chemistry actually changes, so that when you're without an opiate, you just don't feel right. You don't feel normal. And it's an unfortunate thing when you get to that place, because what's going to happen down the road is that something's going to tempt you, something's going to trigger you, and you're going to use again. And then your tolerance has gone down, and you're going to use the same 5 bags, that you did before you got sober, and it's going to put you over. You're going to stop breathing on it.
Right.
And we've had overdose deaths in folks who have relapsed and gone to abstinence-based programs. So the research has shown that medication is the way to go in terms of keeping people alive and getting people into recovery.
What could local organizations like coalitions and youth groups do to support and align with the county's goals?
Medication as treatment, prevention, saying that there are different treatment options out there, what we were just discussing in terms of people who may not have done well in Suboxone, that their methadone is also an option for you, and not being afraid to discuss these issues.
Well, that's the big piece there. There's so many parents that just feel shame or remorse and embarrassed, and they don't want to talk about, what's happening, or individuals even, feel that way. And that's kind of sad, because if they would just feel like, if we could get them over that,
right,
being embarrassed or shamed, that we're here to help them, I think it would make a difference. But that's a tough thing to do.
A lot of the times in Long Island, it's, it may be your kid, but it's not my kid.
Right, exactly.
That's very hard to combat, unfortunately.
Yeah. We tell parents, no, it may not be your kid, but it might be your kid's best friend, or it might be a niece, it might be a nephew, it might be a neighbor. That's why awareness is so important. What messages would you like to share with youth and families of color who may be struggling silently with mental health issues?
Don't suffer in silence. Seek help. There's treatment available. There are plenty of resources. We made the resources easier for you. Go to SuffolkCountyNY.gov, look in the health department page, look for the behavioral health resource guide, and there's plenty of things there that you can go through. There are places you can call, see what these organizations, see what these agencies have to offer. but don't be afraid to get help. There's also the Dash Center. They have 24/7 crisis stabilization, or what they call it. It's a diagnostic assessment stabilization hub, but it's a way to access mental health, behavioral health care in a crisis situation 24/7. They are located in Hauppauge in the industrial area.
Oh, great. That's really good to know. Can you give the audience your website address?
All right. We are the Suffolk County Department of Health Services. Our web address is www.suffolkcountyny.gov. And go there, look for government agencies, look for the health department, and then look for our behavioral resource guide, and plenty of options there and plenty of resources available to you.
Wonderful. That's really great. How can we better simplify the voices of minority youth in shaping mental health policy and services?
Just let our voices be heard. There's it's much more difficult. Don't want to get into politics, but it's just much more difficult in this day and age to have your voice heard as a person of color in Suffolk County. But just don't let anybody silence your voice. So just make your voices heard and really say that we need help and we need to access treatment, and hopefully that more treatment opportunities will be available.
Great. That's great. We really appreciate you being here with us today. Is there anything else you'd like to share with our audience that might be of help to them?
If you're struggling, please seek help.
Good. That's great. Dr. Pigott, thank you for being with us today. We're really happy that you joined us. Thank you for all your knowledgeable information and for the work that you do in our community. It's really important. We have podcasts that we do every month, and we have various topics that are very educational and have a lot of resources on it. If you need anything else, you can contact us on our website. It's www.ndatf.org. Or also you can email us at info@ndatf.org. Thank you so much, and we look forward to seeing you next month.